Officer with the South Carolina Department of Public Health. Thank you all for joining us for our weekly measles media briefing. We'll be joined by Dr. Linda Bell, state epidemiologist, who will provide you with an update on the measles outbreak in the upstate. Following her presentation, we'll take some questions from reporters. Without further ado, I'll turn things over to Dr. Bell.
Thank you, Casey, and good afternoon, everyone. On Tuesday, the South Carolina Department of Public Health, or DPH, reported 27 new cases of measles in the state since Friday, which brings the total number of cases in South Carolina related to the upstate outbreak to 111, and the total number reported to DPH this year to 114. We previously reported that an increase in cases was expected due to settings of public exposures that had been identified, but this significant jump in cases is unfortunate. 16 of the new cases resulted from the previously reported exposure at the Way of Truth Church in Inman. 8 of the new cases were household members of known cases. 1 was related to a previously reported school exposure. 1 was from an exposure in a healthcare setting, and the source of 1 exposure is unknown at this time. So in total, there are currently 254 people in quarantine and 16 in isolation. Based on the new cases, DPH has identified public exposures at 1 new school, which is Inman Intermediate School, and we have 43 students in quarantine at Inman Intermediate. Additionally, students remain in quarantine at the following schools: Hendricks Elementary, Marby Middle School, Chapman High School, Tiger River Elementary School, Air Forest Elementary, Rainbow Lake Middle, Air Forest Middle, Dorman High Freshman Campus. Students from those 9 schools who quarantined successfully without becoming ill are scheduled to be able to return to classes between December 11th and December 15th, depending on the school they attend. Unfortunately, we have students who need to be quarantined a second time due to new cases in their schools. Vaccination continues to be the best way to prevent the disruption that measles is causing to people's education, to employment, and other factors in people's lives in our communities. If people are willing to be vaccinated, receiving an MMR vaccine within 72 hours of exposure has been shown to prevent measles infections, or anyone vaccinated beyond that period could avoid future quarantine if exposed again, and most importantly, be protected from the disease. Of our 111 outbreak-related cases, 105 were unvaccinated. 3 are considered partially vaccinated because they only received 1 of the recommended 2-dose MMR vaccine series. 1 was fully vaccinated, and the vaccination status of 2 are unknown. Because 1 of our new cases stems from an exposure at a healthcare facility, we point out that those potentially exposed to measles should notify a healthcare provider of the exposure before seeking care so that the facility can make arrangements to prevent additional exposures in a healthcare setting. And as a reminder, vaccines are available at many primary care providers' offices, at pharmacies, as well as DPH health departments. And any community partner or organization who's interested in scheduling a vaccination event from DPH's mobile health unit can request a visit to their location by completing the form that can be found on DPH's website. So with that update, Casey, I will turn it back over to you to help with any questions that the reporters might have. Thank you.
Thank you, Dr. Bell. As most of you know, if you have a question, if you don't mind raising your virtual hand, we will call on you in the order that you raise your hand in. If you're not able to raise your hand, you can always send a question in the chat box. So we'll start with Erica with NBC.
Hi, thank you so much. My name is Erica Edwards, and I'm with NBC News. I'm curious whether you would characterize this phase of the outbreak as accelerating, considering that 27 new cases since Friday seems like a lot.
That is a significant increase in our cases in a short period of time. And I think accelerating is an accurate term. I mean, that is a spike in cases that we're concerned about.
All right. And Debbie?
Hi, thank you. Devi Shastri with the Associated Press. I actually have a follow-up kind of similar, but is there anything you can say about the trajectory that you're seeing with the outbreak so far? Is there enough unknown kind of spread happening that it's hard to tell where you're at in the the progression of this outbreak, or could you speak a little bit about that?
Well, the majority of our cases are have stem from exposures in known settings. But what we want people to pay attention to is that with each new case in a under-vaccinated population, the number of contacts around each new case can just spur these more and more cases because the disease is so highly infectious. So without a similarly rapid increase in vaccination coverage, we do expect that around each new case that we identify, and the concern of the spike in cases is that we're not concerned about the number of exposed individuals around each of those new cases.
All right. And Emily?
Hi there, Dr. Bell. Emily here with NBC. I'm wondering, we're in the thick of the holiday season. Are you concerned about holiday gatherings and travel to come?
We are. These were alerts that we sent out prior to the Thanksgiving holiday. When we recognize that really around the Thanksgiving holidays, those are the highest travel days of the year. Social gatherings tend to be, I think, higher around the Thanksgiving holiday, but we do know that people will continue to travel for Christmas and that there will be family gatherings. So those are, again, potential opportunities for additional exposures to people outside of your normal household setting.
All right. Tom? Tom, you might be muted. All right. Sorry, Tom. We'll come back to you if you can figure it out. Mackenzie?
Hi, Mackenzie Musket, Spectrum News. Have you been in contact with any of the surrounding states, like North Carolina, Georgia, just about, especially with the holidays coming up, travel? Is there any worry that this could spread to other states and parts of the country?
Well, absolutely. I mean, we do have the public health authorities nationwide have ways that we are able to report circumstances, outbreak circumstances, and whatnot to one another. And we are similarly monitoring outbreaks in other parts of the country. So yes, we're aware of outbreaks in other states. We're aware, therefore, of the potential for importations to other places in South Carolina due to travel either in other areas in the country or to the Spartanburg County area in South Carolina. So yes, we're monitoring this at the local level. We're monitoring this at the national level. And because we know that measles transmission is unfortunately increasing in other areas, that presents an ongoing risk for those who are unvaccinated.
All right. And we'll try Tom again. Oh, it looks like Tom left his question in the chat box. He asks, his question would be whether there has been a specific outreach to Way of Truth Church due to the large number of cases there.
Sorry, Casey, can you repeat that? Would the weather have
Yeah,
an
sorry.
impact?
No. Has there been any specific outreach to Way of Truth Church due to the large number of cases there?
Yes, we have been working with the church and have found them to be very helpful in complying with our recommendations. And similarly to the church, we are working with the schools and other settings where we have identified exposure. So that's just one of several settings that we work with wherever we find cases. We engage those who are involved to help us with implementing our effective public health measures to prevent spread.
All right. And Richard? And Richard, you may be muted. All right, we'll move along to Deidre.
Hi, this is Deidre McPhillips with CNN. I was wondering about the students who are in quarantine for a second time. Does that mean that the families passed on any kind of opportunity to be vaccinated in between the first time that they were in quarantine and this next time?
Well, with each exposure in a school setting, we evaluate the immune status of those who are exposed. And if we happen to identify the same children again when a second case or third case is introduced into a school, if anyone who remains, who does not meet the criteria for immunity, must be excluded from that setting again. So these are people who are unvaccinated or who do not have immunity from natural disease.
All right, and Erica?
Hey, thanks so much for allowing me a follow-up. I'm wondering if you could provide some more clarity on why you think cases might be accelerating. Is it because of Thanksgiving? Is it because people just aren't quarantining? Thank you.
Well, we, I believe, have been pretty fortunate in having people comply with the quarantine recommendations. The factors that are contributing to the increased number of cases does include gatherings around the Thanksgiving holiday, people who are traveling who may have been exposed in other settings, and we could not identify those as potential sources. And in addition to that, we have a lower than hoped for vaccination coverage in the population. And there is the highly infectious characteristics of this virus. And so all of those are contributing factors.
All right, Emily?
I was wondering when the last pop-up mobile vaccine clinic, if you will, was held and what the reception was like, if you know how many people, or just in general, if you can kind of share, has this outbreak influenced a significant or insignificant number of people to get vaccinated?
I don't have the date that the last mobile clinic was held, but I can tell you that a relatively small number of doses was administered in each of the mobile health unit clinics that we offered. However, we are also looking at the uptake of MMR vaccination in other settings besides those mobile clinics. And we have been able to identify that we have seen an increase in MMR vaccines administered in private practitioners' offices, through pharmacies and whatnot. So we're able to track the number of doses. And so for the month of October, we noted that we did see an increase, in the month of November, actually, we did see an increase in the number of doses administered in November of 2025 as compared to 2024 that month. But there was a drop in the number of doses administered in November of 2025 as compared to October of 2025. So we are seeing a bit of a slowing of the uptake in MMR vaccines in Spartanburg County. And as well as statewide, we've actually seen a bit of a drop in MMR vaccinations. So we saw a little bit of an increase in uptake that was encouraging. Still seeing a bit of an uptake increase from the previous year, but a slowing in that. And we hope that we can continue to get a stronger uptake of MMR vaccines.
All right, Debbie?
Thanks again. I'm just wondering, from your perspective, watching the way that this is continuing to accelerate and knowing that measles is spreading in a lot of different settings nationwide, just, how you're feeling at this juncture and what you would like people to know about the importance of addressing the fact that measles is kind of taking a new hold on not just South Carolina, but across the country.
Of course. I mean, we would like people to be aware that we actually achieved measles elimination in this country over 20 years ago because of the the vaccine coverage. The high vaccination coverage was responsible for us eliminating ongoing transmission in this country. And so now that we are sort of at the brink of seeing continued transmission in the United States for almost a year now, that we've run the risk of losing that designation as a country and having eliminated ongoing transmission. So what we'd like people to see is that picture, to consider the effectiveness of the vaccine in having this disease essentially go away, the disruption of the schools, of the employment that we're seeing in our populations, not to mention the illnesses that are occurring. So that is the picture that we would like people to view from a national perspective. The high success that we achieved in stopping transmission, and what we're confronted with now is that we are faced with ongoing transmission that we anticipate will go on for many more weeks, in at least in our state and in other places, and that is that could be avoided.
All right, Baker.
Hey, thank you. Baker Maltzby with the Spartanburg Herald Journal. I understand that one of the recent cases was traced to a medical setting, and it's made me wonder. I think the general notion is that most cases have been among families who chose not to have their child vaccinated. But if an infection occurred in a medical setting, does that suggest that maybe someone who was unable to be vaccinated, too young, or a medical condition, may have been infected? And so, this thing has kind of gone beyond those who have, made the choice to not be vaccinated or not have their children vaccinated, to others who it's not their choice.
Well, so we know that measles infection makes people sick, so that they must seek care. The exposure in the medical setting was the result of someone who had become ill and was seeking care. But you are correct that the vaccination of any of people in the population also serves to protect those people who cannot be vaccinated, either because they're too young or they may have underlying medical conditions where the vaccine may not be indicated for them. So whether that occurs in a medical setting where somebody's seeking care or whether it occurs anywhere else in the community, increasing vaccination coverage protects the people who are vaccinated from infection themselves and protects the people who cannot be vaccinated. And I just want to reiterate that when people, if we've identified people and we notify them that they have been potentially exposed, we do want to make sure that they know if they do become ill and they must seek care, that they let those healthcare facilities know in advance. We've been fortunate that an instance of that did happen. The medical practice had all the infection prevention practices in place, and we're able to prevent any additional exposures in that healthcare setting. So that's very important for those. If we haven't identified someone directly, the reason we make public notifications is that people can be aware of a potential exposure site. And if they get sick, they can make that notification to the healthcare provider that they may have been exposed to measles. So prevention measures can be taken.
All right, Kim.
Hi, I'm Kim Vickers. I'm with WJBF News Channel 6 in Augusta, Georgia, and we're probably about 3 hours, our viewing area from this area with this outbreak. So my question is, this seems to be spreading pretty quickly. How concerned should people in our area be that this could be headed our way, and how can those most at risk be prepared and stay safe if cases do start popping up around here?
Well, we advise that anybody who does not have immunity to the measles virus be aware that there can just be unanticipated exposures. Even though you're 3 hours away from the focus of this outbreak in Spartanburg County, that doesn't mean that others from that area who don't know that they're infected may travel. So this virus doesn't observe any sort of geographic boundaries. If you're not immune to measles, Because measles cases are increasing in our state and in other places in the country, you run the risk of an unrecognized exposure and getting sick. So at this time, I consider everyone in South Carolina, because we're a relatively small state, easy to travel from county to county, that people should be aware that that risk of exposure exists if you're not immune, regardless of where you live.
All right. And Richard, do you want to give it another try? I'm not hearing anything still, but we have some questions in the chat, including one from Richard. The first is, can you be contagious before a rash appears, and how long after vaccination would a person be considered to have full immunity?
Yes, you can be contagious before the rash appears. The symptoms prior to the rash include they're considered relatively mild. You can have a runny nose, a dry cough, red watery eyes, a low-grade fever. And so in the absence of a rash being present, people may not be aware that these are the early signs of the early symptoms and signs of measles. The virus can be transmitted for as early as 4 days before the rash appears. So, and I think there was a second part to that question that if you can repeat that for me, I'm happy to answer.
Yeah, how long after vaccination would a person be considered to have full immunity?
It probably takes about 2 weeks to get full immunity after vaccination. What is possible, though, is that if someone is vaccinated promptly after exposure within 72 hours, that can prevent a measles exposure. It can prevent a measles infection if they have been exposed and are promptly vaccinated within 72 hours. That has been shown to prevent measles infection.
All right. And Richard's question was, he's in the Charleston area. Is there any concern about cases reaching the Low Country, and how are vaccination rates there? And what can people in that area do to prevent it spreading?
Well, I would give the same answer that I provided earlier, that regardless of where you live, if you if you do not have immunity to measles, I consider that there is a risk of contracting measles, because we're seeing transmission in one area of the state and that can easily go elsewhere. I might direct people in terms of vaccination coverage. They can look at this in a couple of ways. On the DPH website, we have posted the updated information about vaccination coverage in our schools. And in the communities, we do not have that information readily posted, but depending on the specific question, we may be able to get that at the county level.
All right. And Tom Corwin had another question. His question is, I'm wondering, with the declining vaccination status in some school districts, if there has been a recent change in state law that made it easier for families to opt out, and if yes, when that was.
No, there's been no recent change in state law with regards to the allowed exemptions from vaccination for school entry.
All right. And it looks like Debbie has another question.
Yeah, thank you. Could you speak a little bit about what support you've been getting from the CDC? And is there a team on the ground there, or at what point would you request that?
We have not requested a team on the ground from CDC. We do have we do have CDC appointees who have been working with us in the state here for years. So that is support that is contributing to our response here. And we work in close collaboration with the CDC in terms of reporting our surveillance data here. Again, this is something that all states participate in for the notifiable conditions. So we report the surveillance data that gives us a national picture of transmission of measles in the country. And we know that assistance from the CDC is available to us. We haven't made any specific requests for that at this time.
All right. Deirdre?
Hi, thanks for taking another one of my questions. I was wondering if you could talk a little bit more about how you're developing your strategy to increase vaccine uptake right now. Are you learning anything about why these certain pockets of the population are under-vaccinated? And is that helping you figure out ways to reach those people better?
Well, part of our strategy is to work more directly with those who are well connected with the community, who have inroads to provide the education about the risks of the disease, the benefits of the vaccine. And so that is just one of our strategies, in addition to messaging through our website, through social media, any ways that we have to reach the populations who are most significantly impacted, working with leaders in those communities that are recognized as leaders by the impacted population. We're working with them. And so those are among our strategies to reach those who are most impacted by the measles outbreak.
And Richard has another question in the chat. The Medical Freedom Act is currently in the Senate, which would prohibit vaccine mandates. Is there concern that bill might undermine vaccination efforts in the state if passed?
I can't comment. I'm not aware of what's being proposed here, but we are really focusing on our public health efforts, our understanding of how the disease is transmitted, prevention and control measures surrounding stopping the spread of virus by identifying cases and contacts, and providing information about the benefits of the vaccination. So from a public health perspective, that is our focus in working on the principles of disease transmission and what we well understand about how to prevent that, and that is our focus.
All right, Erica.
Hey, I just want to clarify the numbers of the people in quarantine. Did I understand correctly? 254 people currently in quarantine, 16 in isolation based on the new cases. And then do you have a number of the students who have to be quarantined a second time?
No, we don't have the number of students who are having to be quarantined a second time. I'm sorry.
Would you say it's a significant number of those currently in quarantine, or a few, a handful? Like, how would you characterize?
It's not a significant proportion of those currently in quarantine. However, this is a reminder that the maximum incubation period for measles is 21 days. So for any student or anyone to have to go through that quarantine period twice, that's a significant amount of time. But that is not a significant proportion of those currently in quarantine.
All right, and Baker.
Thank you. Just to follow up on my earlier question, do you know? So, if there was a person infected at a medical setting recently, I wanted to know if you all know the age of that person and the name of the medical facility, if it's part of Spartanburg Regional, if it's independent, or what.
So we do not comment on the specifics of any individual. The person is known to have been in a setting where exposures had occurred in a healthcare setting. And I do not know if that is, I cannot name for you now which of those facilities that might have been, because there have been several. That exposure occurred some time ago. As I just want to reiterate that this is a 21-day incubation period. So we would be looking back at a number of facilities where that could have occurred. And I don't have that information at the tip of my fingers at this time.
Okay, so sorry. Exposures probably at several medical settings, but only one infection to have occurred among those that we know of.
Not necessarily. Not necessarily just one resulting infection as a result of exposures in healthcare facilities. Not necessarily.
Okay. Y'all have said that several are still unknown or under investigation, so that I guess that could apply.
That's correct.
Thank you. Sorry, didn't mean to hog everyone's time.
All right. And are there any other questions? Well, we appreciate everyone joining us today. If you do think of any questions later, feel free to follow up with us at media@dph.sc.gov, and we'll get to your questions as soon as we can. Dr. Bell, thank you for your time. We will have this recording available to those who need it, and that will be published on our measles outbreak webpage as soon as we can. Thanks again for joining us, and have a great day.
Thank you, everyone.
Thank you.